Welcome to Unit 6, Medical Law and Ethics. In this section of the unit, we will cover information relating to the Electronic Health Record, or EHR. Behavioral objectives. You should be able to explain the legal concerns that arise from EHRs and their implementation. You should also identify the sources of law that govern confidentiality of health information and discuss their application to EHRs. You should also be able to describe health data networks and the legal issues they present in connection with the use of EHRs. You should then also be able to discuss the potential security problems of emailed medical information. Terminology. EHR is an abbreviation for Electronic Health Record. e-sign is a digital or electronic signature. RIF is a request for information. Encryption is a method of encoding data to protect the information from unauthorized access or tampering when transmitted electronically. PHI is the electric form of personal health information or protected health information. HDN is a health data network. Terms continued. Data element. Under HIPAA, this is the smallest unit of information in a transaction. Data security. The process or mechanism that protects data from improper disclosure or alteration. EDI. Electronic data interchange. The exchange of routine business transactions from one entity to another using standard protocols. More terms. Meaningful use. In HIT, or Health Information Technology, meaningful use is the criteria for the use of electronic health records, or EHR, and related technology in a healthcare organization of any size. PPACA, or ACA, is the Patient Protection and Affordable Care Act of 2010. AHIMA definition of a legal record. The documentation of healthcare services provided to an individual during any aspect of healthcare delivery in any type of healthcare organization. It is consumer or patient-centric. The legal health record contains individually identifiable data sorted on any medium, collected and directly used in documenting the participant's health status. Moving to EHR. The move to electronic health records was given a boost with the passage of the PPACA. There are numerous plus and minuses to the movement to all electronic health records. EHR reduces paperwork and increases readability, as well as providing multiple access to a record. As well, it provides standardization of billing and coding access across physician practices. However, the privacy and security concerns loom large on the horizon as the EHR and technology grow at lightning speed. Unauthorized access, even with encryption, is problematic. Data breach law violations are occurring almost daily in the news. Medical and financial identity theft is also considered a problem. Moving to EHR continued. Part of the problem with the move to EHR is the mix of laws that govern electronic transmission. Initially, the information that is contained in EHRs will be governed by existing state laws, which may not be adequate. An EHR will hold more information than traditional paper records can. Potentially, an EHR will hold the total history of a person's encounters with the healthcare system. The eHealth Initiative is a consortium, a group of individuals and groups that are developing standards for the implementation of electronic health records. In June of 2000, President Clinton signed the Electronic Signatures in Global and National Commerce Act by using his own electronic signature. The Act's intent was to increase the use of electronic technology in healthcare. In effect, the Act states that electronic signatures have the same legal effect as a written hand signature. Key capabilities of an EHR. The Institute of Medicine, IOM, has issued guidelines on the key care delivery capabilities of EHR. The EHR must contain patient-specific health information. The EHR will have access to test results. The EHR will provide links between providers. The EHR will improve coordination of patient care. The EHR will have order entry and management capabilities. The EHR will provide decision support as well. The EHR will provide electronic communication between providers and the patient. IOM guidelines continue. The EHR will also provide patient education and other support for preventive initiatives. The EHR will contain within it administrative processes. The EHR will assist with reporting and population health management. Electronic health systems. The EHR defined. It is a longitudinal collection of patient data. Electronic access is immediate by authorized users. Safety, quality, and efficiency of patient care is enhanced by decision support. It is a more efficient process for healthcare delivery that has cost-saving, record storage, and access advantages. Electronic health systems continued. The goal is an interoperable EHR which would allow for the following: an exchange of pertinent patient information between clinical facilities and authorized entities, real-time exchange of information, high-level privacy and security protection through encryption and other means. The patient may manage their own EHR. HIPAA standards have been established for electronic health systems. The form of the electronic health record needs to be admissible in court. The laws in states and the federal government are often not keeping pace with technology. The HIPAA security rule. The HIPAA security rule defines security as the maintenance of data and system integrity, confidentiality, and accountability of HIT resources. How the agency is able to do this is dependent on the technology in use in the agency. Computer security is generally seen as administrative measures such as firewalls and password protection. Physical security measures have to do with protection of computer hardware and software, views of the computer screen, and the physical layout of the physical plant. Technical safeguard standards to the industry are applied. The agency must keep current with the latest technological innovations. The HIPAA security rule applies to both internal and external communication. The HIPAA security rule continues. Generally speaking, the amount of information in EPHIs makes them very attractive to hackers and to misuse. The sheer number of individual employees needing access presents problems. Secondary users of the information may also need access, which presents security problems. The agency needs to balance security with immediate need for access. The overall goal is to provide protection to data from unauthorized access and loss of critical information. The HIPAA security rule continues. Under the HIPAA security rule, the agency or covered entity must provide for system and data security. The security rule is more limited in scope as it applies only to EPHI, whereas the privacy rule applies to all PHI in any form. The security rule makes no distinction between internal and external EPHI communication. If the agency utilizes wireless communication data environments, they must be able to prevent signals from escaping secure work environments. The HIPAA security rule continued. Requirements under the HIPAA security rule for covered entities include the following. The entity must ensure confidentiality, integrity, and availability of the EPHI that they create, receive, maintain, or transmit. The covered entity must protect against any reasonably anticipated threats to security or integrity, and they should do this through their risk analysis. They need to protect against any reasonably anticipated uses or disclosures of such EPI that are not otherwise permitted or required by the privacy rule. They must also ensure compliance with the security rule by their workforce. The HIPAA security rule continued. HIPAA provides broad, general objectives, but no detailed instructions on how to meet those objectives. The standards are therefore technology neutral due to the rapidly changing nature of technology. covered entities may use any security methods as long as they meet the objectives. Security methods should be based on the complexity of the organization, the security capabilities of their hardware and software, the likelihood and severity of risk to EPHI in the system, and any cost factors they might incur. Administrative safeguards. In terms of administrative safeguards, covered entities are allowed leeway in the implementation of the safeguards depending on their own specifications. They are, however, required to establish a security management process that will prevent, detect, contain, and correct security violations. The covered entity will need to do a risk analysis to determine potential violations. Implementation of a risk management program is also necessary and desirable. Appropriate sanctions for violations also need to be established. Administrative safeguards continue. The covered entity is required to employ a security official who is responsible for compliance with the security rule. The covered entity is also responsible for establishing policies for workforce security, which covers the following areas. Who has access to the information? Is the access within the guidelines for the work role? Does the entity provide security awareness training? And are there procedures for terminating access to EPHI when an employee leaves? Administrative safeguards continued. The covered entity must provide security awareness training. HIPAA allows that the covered entity may design their own training program. Covered entities are also required to design and develop a contingency security plan, which includes the following: a data backup plan, a disaster recovery plan, an emergency mode operation plan, and a test revise plan routinely. Administrative safeguards continued. Security incidents are defined as attempted or successful unauthorized access, use, disclosure, modification, or destruction of information, or interference with system operations in an information system. The covered entity must be able to identify security incidents, document the occurrence and outcome, and provide direction for managing the incident in their policy and procedure manuals. Physical security standards. Physical security is defined as the physical measures, policies, and procedures to protect a covered entity's electronic information systems and related buildings and equipment from natural and environmental hazards and unauthorized intrusion. Physical security standards continued. The covered entity must provide physical safeguards for EPHI. Physical safeguards broadly applies to the entity's facilities, computer devices, and workstations. The entity must provide protected physical access control by providing the following: contingency operations and disaster recovery, a security plan for unauthorized physical access or theft, access control or access control procedures, maintenance records, documentation of repairs and modifications to the physical security such as doors, locks, and surveillance. Workstation use and security. The covered entity will usually have workstations. HIPAA defines a workstation as both the computer and the electronic media in the immediate vicinity of the workstation. Security for the workstation will depend on the covered entity's risk assessment. The covered entity must determine what goes on at a workstation, then design the security to fit the need. Access should be limited to those with verifiable passwords, and the workstation should be lockable. Technical security standards. In terms of the technical standards, obsolescence is built into them. For access control, the covered entity should have the ability to have emergency access to the data as well as unique user identifications. Audit controls, which record and examine system activity, should also be in place. Authentication of users protect EPHI from improper alteration or destruction. Technical security standards continue. Covered entities must have transmission security protocols or measures in place to protect EPHI transmitted over communication systems. This should include encryption software, which will prevent unauthorized modifications during transmission over the Internet or an open network. Organization security safeguards. The covered entity must establish policies and procedures for security safeguards. These policies and procedures must be in writing and retained for 6 years. Revisions in policy must be documented as well. The entity must periodically review and revise the policies and procedures. Business associates must also protect the EPHI as if they are the covered entity. Health data networks. Health data networks, HDNs, are regional health networks working together to share data. The challenge to HDNs are security safeguards, participant agreements, and how to manage security requirements across different platforms. Regulatory issues. 2 regulatory issues are most relevant to EPHI. The anti-kickback laws, which applies to hardware and software for the EHR unless the safe harbor is in effect. As well, the Stark Law, which prohibits physician self-referrals. This applies when the physician has financial interests in an organization and federal or state funds would be used. Electronic health records as evidence. EHR data must be admissible in court. If the EHR is maintained in the normal course of business, the EHR should meet the business record exemption to hearsay. The best evidence rule requires under the common law rule of evidence that the original be presented as proof. There is some question as to whether a hard copy of an EHR is sufficient. The federal rules of evidence are used as the determination. E-discovery. Discovery is a legal process whereby in pretrial each side is able to discover evidence for their position. In e-discovery, the information stored in the databases makes retrieval of specific information difficult. Metadata may be hidden and not reproducible in full form when printed. Some deleted information may still exist, and the data that should not be released may be. This data is unable to be taken back. E-discovery continued. Covered entities should manage their EHR with the possibility of litigation by doing the following. If subpoenaed, they need to suspend ordinary destruction practices. They need to identify and gather relevant sources of data, process the collected data, review the data, and then produce the data. Professional liability. EHRs may increase the potential for negligent liability of the professional healthcare worker. The EHRs may change the standard of care expectations. For instance, a professional may have a duty to access previous records from a history within a health data network. Transactions Code Set Rule. The Transactions Code Set Rule establishes standards for common electronic transactions. The objective of the rule is to reduce the number of formats for electronic transmission. The rule also applies to electronic transmission between entities and business associates. The transactions which are covered are claims, payment, remittance advice, coordination of benefits, enrollment or disenrollment, referral certification, and eligibility. Transactions Code Set Rule. Continued. The rule also applies to media and networks. The rule established the National Provider Identifier, which is a 10-digit numeric identifier with a check digit in the 10th place. The rule also establishes computer codes to encode data elements such as diagnosis, demographics, and procedures. Telemedical records. Telemedicine is the delivery of healthcare using interactive telecommunications and computer technology. Physicians and other healthcare providers are able to view x-rays, read EKGs, auscultate heart sounds or lung sounds, and assist in delivery over the internet. Telemedical records continued. Insurance providers are very reluctant to reimburse for telemedicine. Telemedicine uses the internet for transmission, which is a less than safe transmission mode. firewall implementation is necessary, which also reduces the access capabilities. The upside is that the healthcare provider may use the internet to access online information and communicate with other providers to dialogue. Electronic mail. Email or electronic mail has been utilized to increase communication between patients and providers. A user ID and password is required by the Electronic Communications Privacy Act of 1986. All agencies should have policies and procedures for the implementation of communication to patients through electronic mail. For instance, they will need to be able to validate the sender. Email from the patient should be part of the EHR for the record and is admissible in court.